It all begins with the relationships. You know, it's easy to see the bigger Valley Health, but they all drill down into the smaller Valley Health.
Hello, how are you?
Hi.
We're gonna check your vision, see if we can get your eyes seeing a little bit better with a pair of glasses.
Okay.
Even before we put this mission down on paper, because I was there when we put the original mission on paper, it's always been about taking care of people, regardless of their abilities to pay, to the highest quality.
We live there in the community. We know what the community needs. We're not just coming from somewhere and saying, okay, this is what you need and this is how we're gonna do it. No, we're answering a call, but we're answering a call of what the community is asking for. It goes back to the basic thing about listening. You know, when you go to see your physician, you want to be heard. Or you go to see your dentist, you want to be heard. You're not talked to or talked down to.
Hey, Mr. Goss.
Hey,
how are you today?
All right.
Good to see you.
The community health center model really is based on a premise that let the members of those very communities help to determine the solution so that they have a voice, you know, they have agency to take care of themselves and their neighbors.
How are you?
Raise your hand if you are from or you live in the community that you serve. Yeah, that's incredible, and I think that speaks to how we're able to deliver what we deliver so well. You all know the people that come through your doors every day. You know, you see them at the store, you see them at church. Maybe you're related to them. You know when their family's going through tough times, and you know when there's an opportunity to celebrate something.
Hello.
How are you?
I'm good. How are you? Hi, bud. How are you doing? I always come back to the term relationship. I think that is what is key. The relationship and the service. I want to be in service to those. I genuinely care about taking care of people and doing it from a standpoint that I'm part of their community, right? It's almost a family aspect, right? So not only are we taking care of them on a Monday in the office or on a Friday doing a home visit, but then I'm coaching their kid in Little League Baseball.
1, 2, 3, and go!
When the patients found out that Valley Health was here to stay, they became a member of the community.
We're committed to communities, and that means that we are there for you. Our heart is with you.
Community health centers are an anchor in the neighborhood. We are a provider of service for all ages, from birth all the way through end-of-life care.
Wow, look at all those cameras. Wow. You gonna smile for them? Are you gonna smile for the camera?
Truly, it's just been family. And no matter how big we've gotten, no matter what health center you go to, you're not just a number, you're part of that family.
Wow, look at all those cameras.
You know, when you think of Valley Health, now it's very big, but at the end of the day, it's me. I'm Valley Health. Valley Health is people.
No matter how big valleys become, our mission and our why remains the same. That we can grow to have more than 60 locations, but each location is still just as important to us as it was when we only had 5.
There are all kinds of barriers to healthcare, and we don't want to be one of those. We want to make sure that we're breaking down those walls. And so meeting people where they are, coming into their communities so that they don't have to go too far because we're right there at their back door. We are continuing to hear the need and meet the need and show up.
You know, I think the future for Valley Health is continuing to do more of the same, which is where is there a need? How are we going to fulfill it in different communities? You know, I think of several places that I know that there's grand need in neighborhoods that could use a Milton facility in their neighborhood. And because of that, it's like, okay, well, how are we going to do that?
Billy ball, Billy ball, Billy ball, Billy ball!